Thank you, Chairman. Good morning, ladies and gentlemen. I'm very honored to be here to present my data. I did this research work last year thanks to Professor Bonocore that gave me the opportunity to go to Utrecht and to collaborate with the group of Linda de Vries and Manu Benders. Despite advances in perinatal and neonatal care, postnatal growth failure still remains a common consequence of very preterm birth. Impaired of postnatal growth still a source of concern because it is associated with delayed cortical maturation and is related to poor long-term neurodevelopmental outcome. Several studies of preterm infants evaluated by volumetric MRI have shown correlation between total and regional brain tissue volumes at term equivalent age and neurodevelopmental outcome in infancy and early childhood. The purpose of our study was to investigate the effect of nutrition, protein, fat, and energy intakes in the first 4 weeks after birth on weight gain over 4 weeks and cerebral volumes at term equivalent age. 131 infants born at a gestational age below 31 weeks admitted to the neonatal intensive care unit of Utrecht, the Netherlands, with an MRI at term equivalent age were studied. Nutrition and postnatal growth data over 4 weeks after birth were collected from patients' computerized file. Cumulative intakes of energy, fat, and protein. Energy and protein deficit calculated by subtracting actual daily intakes from the recommended intakes of 120 kilocalories per kilo a day and 3 grams per kilo a day of energy and protein respectively, and weight gain expressed as gram gained over the first 28 days corrected for birth weight were recorded. An automatic segmentation technique was used to quantify 8 different tissue classes: total brain volume, cerebellum, cortical gray matter, unmyelinated white matter, and basal ganglia. Multiple linear regression analysis was used to investigate the relationship between nutrition intakes and brain volumes. Confounding factors such as gestational age, birth weight, postmenstrual age, and white matter injury known to impact brain volume were inserted into the model. Then, neonatal morbidity as chronic Lyme disease, PDA, sepsis, IVH, NEC, known to impact growth in intensive care unit, were also added. Of 198 babies with an MRI at term equivalent age, 33 were excluded because transferred to another hospital before 28 days, and 34 for unavailability of clinical data. So, totally, 131 infants were enrolled. And the characteristics of the study population are shown in this table. As you can see, the mean gestational age was 27 weeks, the mean birth weight was 934 grams, and baby small for gestational age with a birth weight percentile below 10 were 11. And in this slide you can see the incidence of morbidity of the study population that I want to detail. First, we analyzed the relationship between early nutrition and weight gain in the first 4 weeks, and we found that cumulative protein, fat, and energy intakes did positively correlate with weight gain. After correction for morbidity, correlation did persist for cumulative fat and energy intakes. Then we look at the effect of early nutrition on brain volumes, and we found that cumulative fat and energy intakes were positively associated with total brain volume, cerebellum, and gray matter. However, after correction for morbidities and days of parenteral nutrition, Correlation did persist only for cerebellum. According to our model, 1 gram kilo a day extra fat resulted in an increase of 14.2 ml on total brain volume, 1.6 ml on cerebellum, 4.4 ml on gray matter. 30 kilocalories per kilo a day extra energy resulted in an increase of 16.8 ml on total brain volume, 3.3 ml on cerebellum, 8.4 ml on gray matter. Then we look at the effect of weight gain on brain volumes, and we found that weight gain did positively correlate with the total brain volume, cerebellum, and basal ganglia. In other words, when there is less weight gain, there is less brain volume at term equivalent age. Then we were wondering whether less weight gain and brain growth were related to nutrition deficits, and that's the case because energy deficit did negatively affect total brain volume, cerebellum, and gray matter. And in this slide, you can see that energy and protein deficit were positively correlated with the days of parenteral nutrition, and this can be in part explained by illnesses and by difficulties in administering adequate nutrition intake by parenteral nutrition. Then we look at the effect of enteral nutrition on brain volumes, and we found that enteral protein, fat, and energy intake did positively affect total brain volume, cerebellum, and gray matter. After correction for morbidity, correlation did persist except for gray matter. Furthermore, we demonstrated that babies who were at full enteral feeding before 15 days after birth showed a significantly higher total brain volume, cerebellum, basal ganglia, and gray matter compared to babies who did not. In conclusion, we found that slower weight gain during the first four weeks was associated with reduced brain volume at term equivalent age. Furthermore, that lower brain volumes were associated with energy deficit due to prolonged parenteral nutrition and probably related to morbidity. In addition, that cumulative fat and energy intake did correlated with total brain volume, cerebellum, and gray matter. However, after correction for morbidities and days of parenteral nutrition, only cerebellum volume did correlate. Our study highlights the association between early nutrition and brain growth, and highlight the vulnerability of cerebellum to early nutrition, thus preventing poor postnatal growth and supplying adequate nutrition intake. If possible, clinicians might optimize conditions for cerebellar development in preterm infants. Nutrition intervention studies should be initiated in order to optimize the neurodevelopmental outcome in preterm infants. Special thanks to Professor Buonocore, Professor Linda De Vries, Manon Benders, and Professor Virgilio Carnelli that collaborate with me in this work. Thanks for your attention.